Hello, I'm Dan Williams, the Residency Program Director here at the University of Wisconsin. The goal of putting these slides together and sharing them with you is to give you an idea of what our training program is all about and to get a sense for what it would be like to live here and train for 5 years. And hopefully this will help you out in trying to figure out what you'd like to do and where you'd like to be as a urology resident. So without further ado, this is an aerial view of Madison. Madison is the capital of the state of Wisconsin, as you can see, and it's built on a strip of land right in between the two lakes. Lake Mendota is up above and Lake Monona is in the foreground. The university is the whole strip of land between the Capitol down this way towards the area called Picnic Point, and the hospital is situated right in the top of the screen here, which is where you'd be doing the bulk of your training. So what are we looking for? It's a question that comes up a lot. Well, first of all, we're proud that we now have a training program that takes 4 residents per year. We're now in our second cycle of taking 4 residents, and we do look at people from all over the country and highlight outstanding accomplishments in areas of scholarship, achievement, and volunteerism. This is an aerial view of Madison. The big lake right in the middle is Lake Mendota. The smaller lake just to the southeast is Lake Monona, and the downtown area is in this area of land, the isthmus in between the two lakes. University campus is right at this area along the south shore of Lake Mendota. Another thing I kind of like about this picture is just to highlight that yes, Madison is a small city, about 250,000 is the population. And so it's a center of a lot of academic activity with the university, politics with the state capital, a lot of industry in the area. But in looking at this map, if you go about 5 to 10 miles in any direction or so, it becomes pretty rural pretty quickly. So Madison is surrounded by farmland. You also can see at the top right of the screen in the northeast corner of Madison is an airport. So there's a nice regional airport that does get you to a lot of places all across the country, with a short drive from the airport to the downtown area. Here's a picture that I like to show of our medical campus. This is the UW Medical Center right here on the shores of Lake Mendota. And one of the things I like about this picture is it highlights that the main university hospital is right here in the middle. And immediately adjacent to the right is the VA hospital, connected directly to the university hospital. And then just across the parking lot, connected by a sky bridge, is a freestanding children's hospital. So at this one campus, and I'll review these with you in a little bit, we have the children's hospital, the university hospital, and the VA hospital just right down here at the corner of campus. Also wanted to kind of show off that, yes, year in and year out, Madison does get very good scores at the national level for being a good place to live. Last year in 2022, Madison was actually ranked #1 as best places to live in the U.S. And so there are a lot of different reasons why this is a great place to live, and certainly it gets recognition by a lot of folks all across the country for just that. One of the highlights on campus that I always like to show a picture of is the terrace. So again, the university is on the water from the downtown Capitol area all the way to the medical center, and the terrace is a meeting place on campus where there are food and beverages, and throughout the week during the summertime, there are bands, there are performances, there's music, there are movies that are shown. Just a great part of the downtown area. And rumor has it every once in a while there's a journal club after hours that the residents hang out at and participate in at the terrace. So here's our department. This is our picture of our group last year. We have 20 university faculty, 2 clinical faculty, 3 research faculty, and a group of outstanding advanced practice providers, both on the adult and pediatric side. And this is our group. It's a good-sized group. We're all very active clinically and academically and committed to resident education. More specifically, here are the headshots of all of us. The way I lined up these pictures is our department leadership is on the top row, and the middle row is mostly our associate and professors and assistant professors who are involved with the educational aspect of our program. Towards the bottom, we have our research faculty and all of our advanced practice providers. And so we're a good group, very collegial group, and interact very well with the residents. So speaking of the residents, this is really the page that you want to see, because these are your future colleagues should you choose to come here and train with us. As you can see in the picture, we have 2 chief residents this year. One of our residents was not able to complete their training, so we have the 2 chief residents this year, and our 3 residents for the middle group. And again, we're super excited to have our first class of 4 first-year residents with us. And for those of you watching this video, you would be joining the class of 4 moving forward throughout your training. And we have people from all over the country, from all different backgrounds, and really take pride in who we have and who we train. So what are our goals if you were to join us here? Well, we do want to train outstanding urologists and provide you the learning environment that allows you to accomplish that goal of becoming an outstanding urologist through strong clinical, operative experience, and also have a comprehensive didactic teaching curriculum. And it is an expectation that throughout your training you're involved with research, which can take on a number of different forms as you go through your training. I'd be remiss if I didn't give a shout out to Denise Massell. Denise is our residency program coordinator. She's been with us in our department since 2017, but has been here at UW literally for decades in graduate medical education. She's a wonderful resource and really just keeps the program together. She was part of the department. She was with the Department of Anesthesia as their program coordinator for from 1994 to 2017. And we were very lucky to recruit her to join our department, a good 6-7 years ago. Also very, very happy and fortunate to have Anna Peacock as our urology education coordinator. She's been with us for a few years now, since 2021. Prior to that, she was involved with the residency training program in ENT, and also is connected to the university, having gone here to UW as an undergrad. So just to go over a couple of the different teams that you would rotate through in your training. So we have our university adult services split up into 2 teams. The blue service, which is the non-oncology service. You spend time here both as a junior and chief resident, and this service focuses on endourology and minimally invasive surgery, voiding dysfunction, incontinence reconstruction. We also have part of our HOLEP program at this campus. And this is also where we do our gender affirming surgery, the bulk of our gender affirming surgeries here, both as urology alone and also in conjunction with the plastic surgery team. Also at the university campus is our red service, which is the cancer oncology service. We have 4 fellowship trained faculty currently who take care of the whole spectrum of urologic oncology. And again, you spend time with them as both a junior resident and a chief resident. We have a community-based hospital that's part of the UW system, where we have residents rotate through the Meriter 1 South Park campus and the East Madison Hospital, which is part of UW Health. The focus at this campus includes a lot of general urology and routine stone disease. This is also where I personally do most of my microsurgery procedures with our trainees. It is also where we do a lot of our men's health surgeries for ED and Peyronie's. Drs. Lynn and McCachran run the female pelvic medicine and reconstructive surgery program here, which is where you get that exposure both at the university hospital and during your Meriter rotation. Dr. Risk does most of the robotic surgery at the Meriter 1 South Park campus. And Dr. Manicus is very, very busy with the HOLEP program at this campus as well, where you get a lot of exposure in HOLEPs, and we're also doing green light laser prostate treatments at this campus as well. As I mentioned before, we have a freestanding pediatric urology, pediatric hospital, of which you spend 2 blocks of rotations with our urology service, pediatric urology team with Drs. Farhat, Cannon, and Bhatia. And Dr. Kristen Ebert has also been recently recruited to join our group. And so there will be 4 pediatric urologists in the near future who you will rotate with. And also, as I stated at the beginning, our VA hospital is immediately adjacent to and connected to the university hospital. And you do spend time both as a junior and senior resident working at the VA. I'll admit I'm a little bit biased because I trained at a program that had a VA, and I do feel that a VA hospital is a wonderful opportunity for training in urology, given the amount of urologic pathology that many of our veterans struggle with. So just briefly and just a broad overview of what our training program looks like by year. Your first year is 6 months of general surgery and 6 months of urology. That's been a change at the national level over time, where there's more urology during your PGY 1 year. Your second year, when you're a junior resident, you spend time at the VA, the pediatric service, and the Blue service. You also spent some time on the night float, which has been we're now in about our 3rd year of doing the night float, and this has been a very positive change for our residents to the institution of the night float system. During your 3rd year, you also spend a little bit of time completing your night float duties and spend time at the University Hospital on the Red and Blue services, and also rotating at the Merritt or East Madison rotation. During your 4th year, you go back to Merritt and East Madison, go back to the VA as a senior resident, and we also have elective time built in for you during your 4th year. And I certainly wanted to highlight that the flexibility of training. Everyone has different interests as they go through their training, and the elective time allows you to kind of do some special focusing on areas of interest for you. And then as your chief, you spend the bulk of your time at the University Hospital as the Chief of Red, Chief of Blue, and also Chief of Service, which is also allowing you to do some flexibility of training in your final months of training. Wanted to give a highlight and a shout out to our weekly conference schedule. So every Wednesday from 7 to 10, we have protected didactic time for you, where you're able to be off the pager. We have APP coverage of the pagers, so that you can come to grand rounds and educational conferences and learn as much as you can. We have our lecture series that's a 2-year curriculum. We do our M&Ms, journal clubs, indications conferences, and then the second half of that 3-hour block is what we call our REC, the Resident Education Conference, which is usually 1 or more faculty kind of one-on-one with the resident group to have kind of a more informal discussion about various topics, either the topic of that specific attending's clinical or research interests, or other aspects of the practice of urology. And then towards the end of that 3-hour block of time, we found this to be very valuable, that our chair, Dr. Nakata, myself, and Denise, our program coordinator, and also Anna, rotate through week by week and get to meet with all of our residents to convey information that's important for them to know about from a program perspective, and also for us to hear from our residents about what's going well, what's not going well, and affect change where we can, and to improve things based on these program rounds. Throughout the week, there are also other multidisciplinary conferences, including our Metabolic Stone Conference and our Multidisciplinary Oncology Conference. But we're really proud that we've been able to protect this time for our trainees every Wednesday from 7 to 10. Another aspect of our program that I wanted to highlight is our surgical simulation program. Dr. Sarah Best is our faculty lead of our simulation program, and we have a number of modules that are up and running throughout the year, including a PGY1 boot camp, the ureteral reimplant lab, basic and advanced endoscopy sessions. We have a microsurgery session, prosthetics session, and a pelvic lab, just to name a few. And this has been just a terrific thing for our residents to have a hands-on exposure to a number of different techniques for surgery. These are just a couple of pictures of some of our more high fidelity sessions. You know, the resection sessions, And also we've gotten kind of creative as far as using both high and low fidelity. The top left corner, we're doing an endoscopic extraction of green pepper seeds through the flexible cystoscope. At the bottom, we're doing a perk access of a watermelon. And the top right is the more high fidelity session with a mobile C-arm as well, digital C-arm. We do send our residents to the AUA when they're third years, whether they do or don't have abstracts accepted. All of our residents go to the AUA as a PG3. And then also throughout your training, if you have abstracts accepted to the AUA and other meetings, we do support you to travel and present your work at the national and regional levels. Other meetings, such as the subspecialty meetings, with the approval of our resident competency committee, we do send our residents to the subsociety meetings as well, if those fit their career and academic goals. As I mentioned before, for research and scholarly activity, it is expected that you are involved with research and scholarly activity throughout your training. We do not have a dedicated research rotation or research year. So scholarly activity is expected to take place, after hours, weekends when available. Many of our residents do make good use of their elective time, sometimes to clean up abstracts and manuscripts and get those set up for publication. But these are just a couple of pictures of our residents at some of the different meetings throughout the year as well. And lots of opportunity to get involved in scholarly activity with our faculty who are very active from an academic perspective. Throughout the year, we have a number of different lecture series. The highlight of the year is the Euling lectures. We're now in our 22nd year of this endowed lectureship in honor of Dr. Euling, former chair of urology. Many of these faces are probably familiar faces for a lot of you throughout your upcoming interview season, and we're very fortunate to attract just the best and brightest thought leaders in urology to come and speak with us and spend a few days on campus with the faculty and with our residents. Faculty mentorship is also something that we're proud of. All of our residents get assigned a formal faculty mentor when they begin as a PG1, and the goal is to meet at least every 6 months to help set up goals for upcoming rotations, review your performance with you, monitor your scholarly activity, career goal planning, career advising, and to monitor resident wellness. But there's much more appropriately so attention placed on personal and physician and workplace wellness, and we really take this seriously as well to make sure that our residents are as good as they can be emotionally and physically throughout their training, as we know that residency is a tough time, and we take that very seriously. Lastly, we've worked very hard to put together a lot of information and update our website as much as we can. We again are very excited, as you see, that we have now 4 positions available for our training program. For further information about our program, please go to the website. At the bottom right corner, if you click on the resident training manual, we have very detailed information about the different rotations and what it would be like to train here. We also have some nice videos that you would click on this link on the website about hearing from our residents what it's like to train here as well. So thank you for your time and listening to this presentation. Hopefully this helped give you a better idea of what it would be like to live here in Madison and train at our program, and wish you all the best in your application process to match in residency. Thanks.